Breast augmentation, or breast implant surgery, is always one of the top two most common operations performed in this country. There are two types of implants and a couple of different types of operations. The two types of implants are important to understand. Right now we have available silicone and saline implants. Although most people agree silicone implants feel and look more natural, this depends very much on how much of your own breast tissue you have and how big an implant you want. A very thin girl who wants very big breast implants will have to use silicone implants because putting salt water in that doesn't feel and look quite as natural will not please the patient. But someone who has a bit of their own breast tissue and doesn't want a large augmentation, it may be possible to use silicone or saline and they would feel and look the same. When you come in for a consultation, we will very carefully discuss which option is better for you. There are people who will tell you silicone isn't safe. That has never been shown to be true. There's been a great deal of research done all around the world on whether or not silicone breast implants are safe. And every bit of research has shown there is no increase in the incidence of any illness whatsoever amongst women who have silicone breast implants. There are 4 possible places to make an incision to put in a breast implant: under the breast, around the nipple, through the belly button, and through the underarm. During your consultation with me, we will discuss which one's best for you, and in the end, your desire is most important to me. My opinion is the underarm represents the best access for breast augmentation, all other things being equal. The underarm has lines like the palm of your hand. If I put an incision into this line, you will not find it once it's healed. Underarm incisions done properly heal without a trace. Therefore, putting the breast implant in through the underarm represents a technique that allows you to have no visible scar whatsoever. That's not necessarily true if you place the incision around the nipple or under the breast. Another advantage of going through the underarm is that you don't have to cut through the muscle. Now, most breast implants should be placed under the muscle. The muscle is called the pectoralis major. Implants placed under the muscle have less of a tendency to become encapsulated or harden. They feel and look more natural. You can get a mammogram much more easily than if your implant is above the muscle, and the implant won't droop or cause your skin to droop by stretching your skin. So placing the implant under the muscle is very simply done through the underarm because you don't have to cut through the muscle to get the implant in that plane. That's another advantage of going through the underarm. The various options, the advantages and disadvantages of each will be discussed during your consultation with me.